Good evening, everyone. My name is Brenda Ahlberg with the Kenai Peninsula Borough, and tonight we're going to provide you an update regarding the COVID-19 or coronavirus disease epidemic here on the Kenai Peninsula. And with me tonight is Dan Nelson, our incident commander, and want to welcome you, sir, tonight. And we're going to have a lot to talk about. Thanks to those that provided us questions. Dan, thanks for taking time out of your day today.
Good evening, Brenda, and good evening, everybody. Thanks so much again for joining us, and we're really glad to have you here for our evening 7 p.m. Community conversation. Let me get into a few things that happened today and just some brief updates before we go into some new tools and of course, answer your questions that you submitted to us here throughout the afternoon. As far as the Kenai Peninsula Borough, your city and local governments spent some time specifically on a few issues today. So we spent a lot of time with Mayor Charlie Pierce and the borough administration kind of going through the bigger borough picture and how we're going to ensure we're going to continue to provide government services and make sure that those services are able to be delivered in kind of new and creative ways. We've been talking about how you can do business online and over the phone, and a lot of people still prefer to do business in person. It's a little bit more personable and a nice way to do things, but we all know by now we're adapting to those new ways. So the borough administration has been working hard to help us with that and create action plans for all their various departments and go through some of those steps. So that was a significant piece of our morning. In addition, we continue to talk and communicate with the cities and the other healthcare agencies on the peninsula with a specific focus on our fire departments. Mainly today, the question was the same thing that you've been hearing in the news, and you may have been hearing from other cities and localities, is about PPE, personal protective equipment, we call it, as a kind of an umbrella term, where we talk about masks and eye protection and some of these other things that are really so critical in protecting our healthcare workers and our first responders. So we're meeting and assessing all of the PPE that protective equipment needs for our first responders and trying to project out what those needs are in the future. It's pretty common knowledge that there's definitely a demand on that. And so we here in the Kenai Peninsula Borough are trying to make sure our first responders are taken care of, as well as our healthcare providers. We need to keep them safe, and so they can continue to be providing those services to you, the public. Those calls will still be answered. And let me just make sure that everybody is aware that those calls are still being answered. As a reminder, you might see firefighters or EMTs in additional protective equipment, masks, gowns, and those types of things. That's for their protection as well as yours. So nothing to be alarmed about, but as we are in these times where we're continuing to provide that service and making sure we're all safe. That was our main focus for our coordination and our process today. I do have some news to share that came out fairly late in the day, but the Department of Health and Social Services did alert us here at the borough of another positive case of COVID-19. That case was in the Sterling area, and it was related to the previous case in the Sterling area that was announced a few days ago. The specific information has not really been included. It was a late heads up for us. We wanted to share that with you, and we feel that's important to bring that information to you as soon as possible, but we don't have any further information to share on the case. And again, we want to be sure we're respecting privacy of those people that are going through these medical needs. As a brief reminder here before I wrap up my update, remember when we talked about the Department of Health and Social Services or Public Health, they go through an intensive interview process and trying to backtrack where positive people may have had contact with. And I think this is likely a great example of that process and essentially that medical detective work where we were able to confirm that case. So we don't have any additional information on that, but that was a late breaking development today. I think that's most of what we have to talk about today as far as an update. I want to show a few tools and things here, and I think we're going to get to your questions in a little bit. Is that right, Brenda? Do we have questions that were submitted throughout the day?
We did. It was impressive how many people did meet that 2 o'clock deadline to submit questions. That way we could try to get the answers for you ahead of time. Of course, we'll also be providing comments in the thread in tonight's broadcast. And if we don't have the information, we'll certainly try to get it to you. Or if there's agency specific questions, we will not be able to answer those questions on their behalf. So thank you again for joining us. And I am so excited you are going to be able to share with them this blog that we keep talking about. So without further ado, please walk us through what this is for folks.
Absolutely. So I'm gonna put the blog up on the screen, and we're gonna hope the technology does what it's supposed to. We've been talking about this quite a bit, but if you have not seen our website, kpboem.com, or we call it the blog, this is what we call our virtual joint information center, and this is a tool where we put official messaging and important updates from agencies and from official sources throughout the day. So this is important. We do share those things, of course, on our social media, on Facebook and Twitter under KPB Alerts. But this is a great repository for things. And this is, again, really where we want to encourage people to have official information. So let me give you a quick tour before we get into questions. And I want to show you a real neat tool that we just rolled out today that I think will be helpful for folks. So as you come down, we're kind of separated into 3 different areas. This center section here, hopefully you can see my cursor. The center section is just like a blog, which is why we call it that, a chronological update of posts and information. So here, the most recent post will always show up first. This is actually a copy of the Kenai Peninsula Boroughs situation report. We publish this every afternoon, and you can find that on our website. And this gives a recap of the information that we assemble and the status of our various systems and lifelines. And people are perfectly free to read that. And that kind of summarizes, obviously, our situation report, an aptly named document. If we scroll down a bit more, and I'm going to go just a bit fast through these images, as you'll see each page. But if you scroll down as an example, you'll see the subject of our video tonight, the call for questions. So you can see as you continue scrolling through here, news release from the Department of Health and Social Services. This is where you will find official information and the official releases. So if you hear something on the news, if you hear a report, this is a great place to confirm those things and to get a little bit more in-depth information if you're getting them perhaps from social media. So we often will link to our blog and some of this information. On the left-hand side of the screen, as you start, has got some great phone numbers. If you would like, I'm going to make a note here. If you look at this follow by email button, if you wish to put your email address in, you'll get a daily recap each evening of the posts on the blog. That does not email immediately. It saves that all for the end of the day. So you may wish to continue to visit the website. On the left-hand side, you'll find links to some phone numbers of interest. We've been talking about the 211 service for general information about COVID. That number and that 800 number here. And then, of course, KPB Alerts, just as a reminder for folks, is a service that also will push emergency notifications to your cell phone or to your landline. You can register for that. If you have a cell phone and haven't registered that number with us, please take a few moments to do that now. You won't be receiving updates like on the blog or on social media, but that's meant for more real-time emergency information. So as we're thinking about those things and what kind of emergency is on our mind, this is a great time to do that. You can also find links to our Borough Facebook page and some phone numbers for us as well. If we go back to the top here and go over to the right, you'll see links to some of the coronavirus information. These are the official pages. So if you're one of our communities, you want to link to one of our hospital sites. And of course, anybody with children or staff, students in the school district, the link to their website as well. And if we go down here, there's still some links to helpful resources. And of course, all of the official agencies that have a hand in emergency management or this current COVID crisis. So again, all verified information will be here on the blog. So I want to take a moment here and just go through a new map. We have just created a real-time map for the COVID-19 issues on the Kenai Peninsula. You can see that here. under the current situational reports on the right-hand side. I'm going to go over to that page now that I already have open. What this is a geographic tool and summarizes a lot of the information regarding the COVID issues. So as we look here, you'll get a recap here of confirmed cases within the borough, as well as the state of Alaska, and then deaths and recoveries as that information becomes available. I do see that error here under confirmed cases. We just rolled this out, and as things unfold and as data becomes available and gets changed, you might see an error message. So we'll look at that and get that tried to fix, but bear with us as we roll out some of these new tools. Next, you'll see some of our facilities as far as the borough, and you will have a key there as far as open facilities, those that are limited, closed, and what the status of facilities are by area. So you can zoom in using the plus and minus buttons here, and we'll just go into the Soldotna area for a moment, and you can see the status of facilities that are closed. So this is River City Academy here that we see, which we have closed. If I click on this one, is the, I'll scroll up here just a bit, apologies for the monitor, is the Central Peninsula Landfill. Note that one does show open, as we've talked about in the past. So this is a great way to geographically take a look at borough facilities and school district facilities and see what their current status is. As we continue on, I want to point this out. This is some very interesting information, is some gathered from various sources, the impact planning report for the Kenai Peninsula Borough. So it gives some information on population, income, and some of those types of things. But we look at some estimates on people with insurance, at-risk population, and many, many other things. So I encourage you to take a look at that planning report. It tells you a little bit about the borough and some of the numbers and assumptions that we're using when we look at our impacts. Down you'll see some feeds from both the borough KPB alerts and the school district Facebook pages. Another great way to keep us up to date with things that are happening. You'll see the most recent posts coming up through there. If you're a resident of one of our cities or use any of their services, this will provide links to both their website and their Facebook pages. And as we continue to scroll through here, show other links. So starting out, of course, with our Joint Information Center, that one-stop shop that got us here, as well as many of the other official agency pages. So we're going to be working on this tool, hopefully improving it. We literally got this done about 30 minutes before the broadcast tonight. So thanks so much for joining us. You're the first seeing it, and we're going to continue to build this and improve it. So that just gives a little bit of a quick overview on some of the tools we have. So please let us know and provide us feedback, and we'll, like I say, we'll continue to work through some of these.
Thank you for that, Dan. While you're figuring that out, thank you for the presentation. What I'm so excited about is most folks don't realize how comprehensive and up-to-date our GIS department is. They do a phenomenal job. In fact, they're known to be one of the best GIS departments in the Northwest. So I just want to really thank them for putting this together for our residents. In line with questions, you're ready for questions?
I feel like I've been talking a lot this evening, but go for it. That's what we're here for.
All right. So one of the questions that keeps coming up is some folks that were quarantined in the lower 48 have come home, and now they're wanting to know, should they quarantine again now that they're back in Alaska?
So the short answer to that is yes. They should be quarantining again, and we've been talking about that here for the past few evenings as things have ramped up, as we're trying to continue to flatten that curve. However, Governor Dunleavy just had a press conference at 6 p.m. this evening, about an hour ago, and announced a new health mandate. And that health mandate, number 10, I believe it is, does mandate that those persons that are coming from the lower 48 essentially quarantine for 14 days, self-quarantine. So I'm sure we'll have the link to that mandate here on our blog or somewhere that it's easily accessible, but I'll summarize that essentially it directs travelers that are arriving at the airport. Remember, our land borders are closed at this time for all but non-essential traffic. Most people are coming through the airport. It directs them as they land at the airport to immediately go to their quarantine location. And there are some definitions of a quarantine location. If you are a resident, it's your home. And if you are a visitor, I believe it's your hotel room or other place you're renting, and stay there without contact for 14 days, without that physical contact, with the exception of seeking emergency medical care. So that full summary or that full text will be available. But yes, it's so important for people to follow that mandate and to immediately go from the airport to that area, that quarantine place, your home or your hotel room, what have you. Again, the spread of what we know about this virus and the ability for it to spread can't be understated. So this is very serious, and the governor has obviously made it serious with this mandate. So short answer, yes, 14 days as soon as you report back to Alaska.
The governor had also, there was two mandates that were issued, number 9 and number 10. Number 9 talked about the businesses where congregations or gatherings of individuals that are within 6 feet of each other must stop operations. And that include hair salons and spas and nail salons, barbershops. There's quite a list. There's a list of 8 different types of facilities that are to, cease operations. And one of the reasons why is because we're trying to eliminate those gatherings of 10 or more people. So wanted also to point that out. As Dan had said, these mandates that were literally just released will be on the blog as well as our Facebook page when we're done with this broadcast. What is it that we can do to hunker down like other areas, meaning other municipalities that have been told to do so by a mandate based on their municipality code? If we can't be told to do that by the borough, what is it that we can do to hunker down? That keeps coming up as well. People are very concerned.
And rightly so. And you know, we're formed as a second-class borough here on the Kenai Peninsula, and I've talked about that, where you know we have very limited governmental powers, you know, as compared to say the municipality of Anchorage or a big city in the lower 48 that has completely different laws. You know, the answer that I would give to you know, what can we do? How can we hunker down? I think most of us know the answer to that. And really what I would like to encourage people to do is follow the mandates, follow the instructions that you've been given, stay home. Mayor Pierce, we talked this morning at length, and he really wants to encourage members of the public to stay home. We're not mandating it. We don't have that power. But I think at this point, we all know the right thing to do is to stop that spread, flatten the curve. Let's not put our neighbors and friends at risk. So the first thing to do is make sure that we are all basically hunkering down. We're staying home, and we're not allowing that spread to continue. There are some occasions where we can certainly go out and enjoy some outdoor activity with that 6-foot distance, that physical distancing, you know, taking advantage of drive-through and pick up orders for meals and going to the grocery store and taking care of those necessities and medicine. But, you know, beyond those things, stay home. And if you have friends, if you have family that, you know, maybe aren't taking that as quite as seriously, it's time to have a talk with them as well. Because if we don't do this together as a community, as friends, as family, it will not work. And we're still not going to be getting ahead of this thing. And we have seen, you know, other parts of the country that, you know, essentially started this process before us, other countries in the world that already have been dealing with this much longer than we have. We as Alaskans have the benefit of seeing what they're going through right now. New York City is a great example, is a very intense cluster right now in the country. Let's take those lessons from them. We know what to do. Let's stay inside and stop the spread.
Very well said. Another question that came to us today before 2 o'clock was very interesting, and you may or may not know the answer to this, asking for some scientific facts. Do buildings with recirculated air systems, also called HVAC systems, spread the virus?
And I do not know the answer to that one right off the top of my head. We can do some research. So let me say if we can find some verifiable, some good factual data on that. Maybe we can put that in the comments below. But I do not know right now. Apologies.
All right, thank you for that. And also, is the 6 feet apart really enough distance?
We're using guidance that we're getting from CDC in the state of Alaska, and their guidance is all telling us that that 6 foot separation is sufficient and is what we need to keep that physical distancing to help mitigate that transmission. Certainly if it makes people feel better, personally, I think you can go more than that, but that is current guidance, so we follow that and trust their recommendations on it.
And I think it's even more well stated to understand that we shouldn't underestimate the importance of protecting our elderly that are in senior living homes, senior living facilities, or those that are in hospitals that the restrictions are in place, to go above and beyond because they are so vulnerable. So that may also be why there is confliction for some folks, that for those of us that are not in those vulnerable states but do have the ability to be 6 feet apart, that also allows us really to get outside and play, to get outside and to some extent still be social, but still adhering to the CDC requirements. So thank you for that information. The next question that I found was also really interesting, and it's a good one, is what are the chances of infection from pickup orders? How should we handle our packaging?
There are some differing things, and I know that they have been looking at trying to experiment with different packaging and different surfaces and materials to see where and how long this virus can live. Depending on the kind of packaging, you may have a different answer on that. And I'm going to be honest, I've heard so many different things, and they've been changing recommendations that I don't want to say and give one definitive answer. But a couple things that I would suggest is if you are going out to do pickup orders or picking up your groceries or any of those types of things, if you've got exterior packaging like a bag that you can discard after bringing that into your house, that's a very smart thing to be doing. Of course, washing your hands immediately after handling packaging like that. If you have food, to go order, maybe transferring that to a plate or something, and then discarding that packaging. Another thing that you may wish to consider doing is wear gloves, like nitrile gloves or latex gloves, when you go out to pick up your order. Everybody will understand, and then discard them once you've handled that packaging. After you discard the gloves, be sure you also wash your hands again or use that hand sanitizer. Washing is best for at least 20 seconds. So I don't have a specific answer on time or anything like that, but there are some real good precautions like that we should be taking.
Another question that also came to us are how many test kits do we have on the Kenai Peninsula, and when can we expect those that would be available for residents to get checked out?
So there's a differing number of test kits every day as people are looking at different tests that are being used and issued to residents and based on recommendations from their healthcare providers. So I don't have the exact number off the top of my head. I mean, we certainly do have the swabs that have been discussed for the testing, and we have a sufficient number right now. But I want to kind of go into a little bit more detail and explain what some of our healthcare partners have shared with us in that sense, is that, as we look at people who have symptoms or potentially are showing signs of an illness, your healthcare provider is going to go through and try and do some screening and determine if what you have is COVID, if maybe you have influenza or the flu, or perhaps a cold or some other type of respiratory issue. It's entirely possible they may do tests to determine those conditions before recommending and referring you for a COVID test. So it's critical to follow your healthcare provider's instructions. Dr. Zink today, as she was speaking from the state epidemiology and DHSS, that um, having those tests done is not at all a preventative measure. It's not something that we would ever get to the point of where we're going to test everybody. They will not, simply will not do tests on people that are not showing symptoms, even if they live, or excuse me, even if they work in some type of critical infrastructure. That was something that was mentioned today at the governor's event. So the best advice when it comes to testing is to contact your healthcare provider, especially if you're showing symptoms. Go through their screening questions, go through your history and those things, and follow their recommendations, because they may want to test you for something else besides using specifically a COVID test. And those tests are taking quite a bit of time to get processed as they get sent out and the information comes back to us. So a long answer to that question, but as we get into medical things and really our healthcare providers, our doctors and nurses, they know best. We're able to give you the best course of action. So the best thing I can tell you on that is call them and follow their advice, because they'll be able to give you advice specific to your case.
Thank you for that. I will say that Mayor Pierce has been completely supportive of the actions here with the incident management team, and certainly with the importance of why we should be following these guidelines to help slow the spread so that we can get through this together and be able to come out on the other side stronger as a community. One thing that is also coming up as a regular question is, when is the borough going to petition Governor Dunleavy to impose tighter controls? And why is it as a borough we can't do that? I know you've done a great job explaining that, but perhaps you could give us a little more insight into that, please.
And it's a reasonable question. It's one that, certainly, we don't, it's hard to get into conversations about laws and powers and regulations and things. And that's not real clear. So to that, what I would say is kind of a little bit what I said earlier. And so it bears repeating. We all know what the right thing to do is, so we don't necessarily need Governor Dunleavy or someone in authority to tell us that, you have to do these things. Here's a mandate. When we as residents, as neighbors, as friends, you've been hearing us talk about this for several evenings. You've been hearing, if you tune into any television outlet or any internet news source, you've been hearing the same thing. Stay inside, stop the spread. We know that this disproportionately affects people that have at-risk conditions and the elderly. We also know that children and young people and healthy people can be carriers, and we know that there's a significant amount of time until those people might show symptoms. So you and I can be perfectly healthy and we might be spreading it. And if we're not socially distant and we go over to a grandparent's house, or we go try and visit somebody in a senior living facility, or go to somebody's home that might be ill or have another medical condition that's not related to that, what are we doing as people? We're contributing to the problem. We're contributing to the possible impact on the healthcare system. We're not being good friends, we're not being good neighbors, and we're not being loving family. And that's really, I can't emphasize that enough. And Mayor Pierce and I talked about this, and that's just absolutely the bottom line. So I certainly respect the question. I think it's a good question to ask, but I'm going to turn that question around and I'm going to ask you, if you are not doing these things, why? And if you're not, you are putting other people at risk, whether you know them or not. So simple as that. So let's stay inside. Let's get through this like Alaskans do.
Very well said. In fact, that is perfect timing. It's 7:30. We're going to end our presentation tonight, and we will continue to monitor the comments and provide answers as we can. And we look forward to providing you additional information tomorrow night. Good night, everyone.
Good evening, everyone. Thank you.